So, hello everyone, I'm your host Sunanda Naik, and you are watching News Meter. Today, on 22nd July, World Federation of Neurology is hosting the ninth annual World Brain Day. On this occasion, we have Dr. Sudhir Kumar, Professor and HOD, Apollo Institute of Neurosciences, Hyderabad, to share some insightful knowledge on the topic.
First of all, World Brain Day is celebrated to raise awareness about brain and also the brain health and also the brain diseases, and that is why this year's theme has been chosen as brain health for all. So everybody needs to know about the brain health, and based on that, to achieve that aim, there have been five pillars, described in that. The first one is awareness, which means everyone should be made aware about the brain health, and also the brain health is mandatory for maintaining our mental, social, and physical well-being. The second pillar is prevention, and as we all know, prevention is better than cure. So there are various strategies that can be followed to prevent brain diseases, which includes many aspects like our diet, exercise, and many things. So that people are have to be made aware of that. The third pillar is advocacy, in that global efforts are required to for maintaining optimal brain health. So every state government, central government, and countries across the world, NGOs, they all have to pitch in so that the brain health for all can be achieved. The fourth pillar is education, and education, as we know, is the key for achieving anything. So people have to be educated how to take care of their brains and what are the common symptoms of brain diseases so that they can seek help when necessary. And the last pillar is the access. And we know that there is a big divide in the population. Some are rich, some are poor. So access should be made available for all, irrespective of their financial status. Everyone has to be made aware of how to take care of their health of their brain. There is always a debate which is a more important organ, whether it's the heart or the brain, and the debate continues. But definitely brain is the center, because even the regulatory center for the heartbeat and to maintain the blood pressure is there in the brain. So one has to take care of the brain. Things are simple, but whether it's a diet, exercise, proper sleep, less stress, whatever. So definitely people should take care of the brain, and if there are any brain disease symptoms, then they should take help of the doctor or the neurologist at the earliest. Definitely, many people think that brain disease means somebody has gone mad or they have a mental illness, and so they try to hide. And this is most commonly exemplified by a disease what we call epilepsy, which was also known as seizures. In that, people feel that there is a belief in villages and even sometimes educated people that some ghost or some abnormal person has entered the somebody's brain and then seizing them, and then they're behaving abnormally. But I would like to make public aware that it is not the case. Epilepsy is a brain disease like any other brain disease, and which can be treated properly with medications alone in most cases. And because of stigma, as you mentioned, many women who have epilepsy, they don't get married easily. The studies have shown that women with epilepsy, they take 5 years extra time to find a proper match compared to those women who don't have epilepsy. And in today's world, when we say we're all educated and we have awareness, this doesn't fit in our society. And many women, they need to hide their illness from their in-laws and husbands, and then they get married. And when the husband goes for work or to the office, then secretly they will remove the tablet from the boxes and then have it. But the problem comes when on the holidays, and when they're when the husband is together, when family is together, then they're not able to take medicine, and that day they get the fits. So I want to tell everyone that epilepsy is a treatable condition. There is no need of stigma. And similarly, not only epilepsy, there is also common belief. People feel that migraine, like which is the commonest cause of headache, people feel that there is no cure. Many patients come to us, come to me after suffering for several years. I said, why do you delay for so long and didn't seek help? So, doctor, I was told that there is no cure for migraine, so why should I come? So that is not the case. There are excellent treatments today for migraine, and you must see a neurologist because you can lead a pain-free life, and nothing like leading a pain-free life. And the third disease I want to highlight is about dementia, or what is called memory loss. So the moment somebody is 60 plus and if they start forgetting, we blame on the old age. But I want to tell that 60 is not the old age, because one can live up to 100 years. Anybody who's 60 plus and starts forgetting, it could be an early sign of dementia. And with proper evaluation, many causes of dementia are treatable. So don't label some person having memory loss as old age related memory loss. It could be a dementia, and seek help. So yes, so as I was telling, so I want to share an experience. There was a couple who you really loved, and they wanted to get married, but the woman had epilepsy, and I had been treating her for 3 years, and she was doing very well without any seizures, single medicine, and totally, doing well. So then, because they wanted to get married, but the boy's family, they were against. I said, why do you want to marry some woman who has a disease, who has some brain disease, mental illness? She will not take care of you. She will not take care of your kids. Your kids also may get epilepsy. So, but then, so first she brought her, fiancé, or you can say boyfriend. Then I counseled the couple, and so he was convinced. Now the tougher job was to convince boy's family, and then it took me, 1 or 2 sessions to convince the, boy's family also. And then, but after that, finally they were convinced, and I have followed that family for more than 5 years now. So they got happily married. Now she has one child. Child is also healthy. So it's a very, and then she's doing a good job in a good company. So what I can say, and so I started seeing her when she was a teenager. Now she got married. Now she has a good family. So like this is one example, but I have seen many women who had epilepsy, who are doing well in their lives, having good jobs, good family, and this is possible for every single person who has epilepsy. So they are not less than anybody else in jobs or excellent in studies. So don't, and they did not hide. They can proudly say that, yes, I have this illness, but despite this illness, with proper treatment, I'm doing well. And they can be a source of inspiration for others also, because it's a common problem, as I said.
Wonderful experiences, sir, indeed. And before winding up, can I just, know any personal message from you for this Brain Day?
Yes, I would like to say that prevention is better than cure. So I would like to highlight how you can take care of your brain. In that, the most important is, sleep. The person has to sleep for 7 to 8 hours at night, and this is something which can be easily done. It doesn't cost us any money to sleep. The second part is the diet part. So it is now a fashion to eat out occasionally is fine, but not on a regular basis. And there are certain foods that are good for brain, like having nuts, especially walnuts, or blueberries, broccoli, certain fish, fatty fish like salmons, tuna. So, and then eggs, rich source of vitamin B12. So one should include all these things in their diet and keep away from cigarette smoking. It has no benefits whatsoever. Keep away from alcohol as much as possible. The exercise is another important thing which keeps the brain and the rest of the body healthy. Recommendation is 150 minutes of exercise in a week, and keep away from the stress. Always, do things that make you happy, and whatever gives you stress, try to stay away from that. So these are some of the small things one can do to take care of the, brain. And if somebody has high blood pressure or high blood sugars, take treatment, because if we keep our BP and sugar normal, we can reduce the risk of brain stroke.
Thank you so much, sir. Thank you for joining us today. I hope that your knowledge will indeed help many people who are, suffering with brain disorders now, and they will definitely seek for help as soon as possible if they need. Thank you so much, sir, for joining us today.
Yeah, thank you for interviewing, and thank you for listening.